Now our chapter 1 of session wise, if we consider 6 chapter, the first is the values in sexuality. Just we go ahead from the current slide. And just people are joining this. This is a session 2 which consists about content is counseling, psychotherapy, sex therapy, sensory focus, pharmacotherapy, coital postures, man and woman similarities and differences, and what man and woman wants, personality evaluation and assignments. Okay, just I'm admitting others. Mini is admitting. Okay, fine. Joining. Dr. Damodar is joining. Okay, fine. Session 3, further we divided into 10 chapter particularly included in this session 3 is masturbation, homosexuality, oral and anal sex and consummation, sex factors helpful in treating infertility, male infertility, myth and misconception, FAQ, most frequently asked questions, hypoactive sexual desires, sexual aversion disorders, male erectile disorders, and premature ejaculation. And in session 4, male orgasmic disorder, female sexual arousal disorder, frigidity, female orgasmic disorder, vaginismus, dyspareunia, painful coitus, sexuality in aging, sex in some common conditions, premarital guidance, and sexuality education and sharing with you. Every now we will discuss one by one. First session, we will start from the first session. These are the some assignments that we will complete in another Zoom meeting. First, we will go for what will include assignments and counseling, systematic desensitization, cognitive behavior therapy, behavior modification, and PTEQ, personality test and emotional quotient, and behavior activation therapy, and others. And stem cell therapy we will take in some part. First chapter of first module is values in sexuality. What do you mean by values in sexuality? One thing you must remember, every person is sexual. He may be heterosexual, he may be homosexual, he may be transgender and other group, but he had values in as well. Sexuality is the natural and healthy part of living. All persons are sexual. Sexuality includes physical, ethical, spiritual, psychological and emotional dimensions. Every person has dignity and self-worth. Young people should view themselves as a unique and worthwhile individuals within the context of their cultural heritage. Individuals express their sexuality in varied ways. Parents should be the primary educators of their children. In pluralistic society, people should respect and accept the diversity of values and beliefs about sexuality that exist in the community. Sexual relationship should never be forceful. It should be the loving matter, not coercive or exploitative. All children should be loved and cared for. All sexual decisions have effects and effects are and conjugation both. All persons have right and obligation to make responsible sexual choice. Young people develop their values about sexuality as a part of becoming adult. Now, individual families and society benefit when children are able to discuss sexuality with their parents. Sometimes there, what is the use of this sex to understand the sexuality? One thing in our clinical practice, when a patient comes and we have to evaluate love map, just what we will do, those 1 minute. What? Though, please unmute yourself. Those who are not unmuted, please unmute. Some voice is coming. Where is? I don't know. He is asked to unmute. Ashok Kumar, you are not unmuted yourself. Please unmute. Mute yourself. Don't unmute. If you want to ask that time, you can again unmute. First, you mute yourself, please. So there will be no disturbances.